How's he doing? Tonight? Damn this guy. I sent him an email because he said, I'll go ahead and put him in quarantine. So he promised me he would come, let us.
What's the horse's name?
And go through the whole process here.
What?
And he said, oh, I'll be there in January. Then he said February. Then he said March.
Oh, we'll have you write it out here. Okay. Okay.
Yeah.
Hi. Yes.
But stopping all right? Yeah. And do we have a place to stop him when he goes in quarantine? Carolina's all right, the ground's all right.
What did I do with my 16 gauge?
Have you done any lead changing with him? That's not bad.
I laid my one needle down. Excuse me just a second. I laid my needle down. I gotta come right back. I laid the needle down. Show you something here. She's got her neck out. Check her hole.
They can't get anything
Okay.
on their camera
Okay.
and his sound,
That's fine.
so then you have to run back and forth.
That's fine. That's fine. I just need to take the pictures in the shade and stuff, but that's fine.
That's why I was asking if it was
Yeah.
okay now that
Yeah, that's fine.
Oh,
Okay.
he's still in the shade. Wait.
Sorry. Get him. You can bring him over here if you want.
well, I need
You get where you need to be, and let me know.
Kind of like in here, so I can look down on
Okay, that's fine.
with his back.
That's fine. That's fine. Okay. 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 You want me to go ahead and start? Okay. First of all, when I'm checking out a horse, I'm checking from the head all the way down to the base of his tail. And when I first approach the horse, is basically get the horse used to me. Make sure that he's relaxed, because I am. Whoop! Don't eat my ink pen and my wire. You definitely don't need that. So basically, I want to get him used to me because I am probably going to be putting needles in this horse, or maybe doing adjustments on him. So I want to make sure that he's comfortable with what I'm doing. So first thing I'll look at when I'm looking at the horse, I look at his tongue and I look at his gums. Now when I look at this horse's tongue and gums, his gums are very pale and his tongue is a little bit lavender. His saliva is very tacky, very sticky. That's very important. When I checked his pulses, I'm checking his pulses Eastern medicine wise. There's 12 different pulses that I'm looking at. When I check his pulses, I find his kidney pulse is down, his spleen pulse is kind of erratic, and his liver pulse is up. So when I'm looking for that, I'm looking for issues that may be anywhere along those issues, along those meridians. So I'm going down along his neck, turn him around to the side just a little bit so we can see this. Let's see if there's any reaction here. Just turn him just a little bit. Just turn him on around that way just a little bit. So he's kind of sideways. There we go, right there. There you go, good job. Now, what I want to do is see if this horse has got any kind of problems with his neck. And he does. So, I'm going to show you this. See that? I just barely touch him behind his ears and he's throwing his head. Now, to find out whether this actually is a neck problem or a hip problem, is I want to find out where he's most sensitive at. There's a point right underneath the ear. See if I push on that, bear my thumb in there, look at him throwing his head away. Now, I'll go to the opposite side and do the same thing. He's not moving his head. What he's telling me is that his neck is out on this side. If I go on this side, he also will react. See that? He also will react. And he will react again on this side. But look at the difference in the reaction. He's basically got his neck out up here at C1. So if you feel across the top of his neck, you'll feel that there's a difference between the right side and the left side, how this is displaced. And it's displaced, so what happens is his neck is out a little bit on the left side. So when I did thermography on him, I'm checking for areas. He's got a little bit of a hot spot right here, but he's also got a hot spot right in here. So when we go down here, let's see if he reacts. See that? If you check and go down his neck lengthwise, you'll feel that there's a difference in this cervical vertebrae on this side compared to this side. He's got this C5 out this way a little bit. He's got this neck out this way a little bit. He's got the C5 out this way. And you come down in here and you check along his shoulders. Come down in here, check in his chest. See if he's tender anywhere across his chest. There's points along in here that we're looking for shoulder issues, or we're looking for neck issues, or we're looking for leg issues. And as we go down along the sides here, now, see that? He's very tender right in here. This indicates he's had a lot of shoulder pain. Now, when I look at him, he's also tender right down here with the thermography camera. Right down just behind the elbow, just around the ribs. So, I want to make sure that we don't have an issue going on down this leg, or we don't have an issue with the ribs. So we'll go down his back along his side here. Now, I told you his liver's up. I'm right at a liver point right there. Look how reactive he is. See that? Then I come down in here. There's a spleen point. See how reactive this is here? All I'm doing is putting enough pressure on here like I would if I was going to write with an ink pen. So as I do this, I get down to this point. This spleen point is very reactive. I told you his spleen is very erratic. He's also got very sticky saliva. His tongue is lavender. The lavender indicates that he's got a lot of stagnation of blood going on in the liver, but he also has some spleen issues going on. So he's going to have a little muscle soreness. He may have more pain across the hips or the neck. He's also got some pain in his hips too, and I'll show you here in just a minute. So here's the kidney. His kidney is way down. So he's kidney deficient, he's liver excess, and his spleen is very erratic. So we're going down here. Now we get down in here around the sacrum. Now look at this point for the hip. Look at that. See that? These are points specifically for the hip. He's extremely reactive. Let's turn him around this way just a little bit, or around the other way. Let's go around the other way, so we'll do the other side. Let's do the other side. We'll see if he's reactive on both sides. So as we go down along the neck here, we've got 3 or 4 meridians that come down along the neck like this. And we want to make sure that you go over all these meridians, because each one of these meridians can tell you something different. So get down along here, find nothing here. Down along here, find nothing here. Down along in here, we find right here. This point right here, stomach 10. The spleen and stomach work together. This point right here can be very reactive if you've got a stomach issue going on, but it also can be reactive if you've got problems going on with the stifle. It can also be reactive if you've got a problem going on around the ear, around the eye. So you come down here and see all the way across this shoulder, he's sore. And you can see it on the thermographic image on this shoulder. This shoulder is sore right here and right in here. So if we go right in here, look at this. See that? He's very, very sore right in here. And I don't know how he's performing. Is he performing pretty good? Is he showing any kind of issues or anything like that?
At the moment, let's call it good.
Okay, at the moment he's moving pretty good. And this horse has got a lot of heart. But see this right in here? I'm hitting right on the liver alarm point right there. I'm hitting right there at a heart alarm point right there. So I get down along in here and go all the way down along the ribs. Get right here at the liver point again and look at this. See this? Come down in here, get right to the spleen point. See that? There's the kidney. Look at this. Now, come down in here, across the hips. Look at how sore these hips are. Then as I'm going down along here, I'll go across the back here to see if it actually is a stifle issue. If it's a stifle issue, if I go down along the back of his legs, a lot of times these horses will react. They'll react quite a bit. It's not a particular stifle, it's a hip issue on him. Now, the thing is it's not exactly the hips that's causing him the problem. It's his pelvis. So what we do on him, and I'll show you right here, right here. If I take my hands and go across his pelvis right here, there's also a big difference in temperature on this side and this side. There's also a big difference in the musculature on this side and this side. So he's telling, this pelvis is actually tilted to the right. It's tilted to the right, and if you look at him from behind, you'll actually see that the musculature is just a slight difference in stuff on him from the back, looking on the right to the left. It's definitely different. So you come down in here and you're looking at other issues here. You're feeling down along these legs, see if there's any difference. Now there's points on the feet called ting points. And what I'm looking for, there are 2, 4, 6 different ting points on each foot. So I'm looking for each of these ting points and stuff if there's any reactivity on them. So I go down here and feel they're just above the coronary band. So when I go here, as I'm feeling along the outside here, I get a point here, it's right in the very middle of his foot, called a triple heater point. On this foot, triple heater. Triple heater meridian comes up here, right across the elbow, goes right across his shoulder here, right behind the ear, ends right up here around the eye. So there's something going along with triple heater meridian, and it's most likely going along right in here or right up here. Okay? Now, then, so we got triple heater there. We got stomach and gallbladder on this foot. Let's turn him around and face him the other direction now. Good boy. Good boy. Good boy. Easy, 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 easy. Stomach and liver on that point. And triple heater on that one. Let me write this down real quick in my clipboard. So what I'm looking at is reactivity points on certain meridians. And what I find on him is the triple heater on both front legs, right and left. Stomach on both legs, rear legs, the right and left. The gallbladder on the right, and the liver on the left. Now, what we need to do is we need to adjust, do some chiropractic adjustments on him first. What I'm looking for is where things are most reactive. And like I say, right here, if you feel these muscles, there's a definite difference in these muscles. You come down here and you feel the spine. And as you feel the spine, you're feeling for differences in movement along this spine. Does it move differently from one spot to the other? Yes, right here. He's got this L3, lumbar vertebrae L3, which is right at a kidney association point. Kidney in Eastern medicine controls the bone, the spine, the brain, the central nervous system. Anytime we're seeing subluxations on these animals, we tend to find there's a kidney issue going on. We treat those kidney issues, and a lot of times these subluxations will correct themselves, but this horse needs adjustments along him too. He's got his pelvis tilted to the right. He's got L3 out to the right. He's got a problem going on up here on these shoulders, so I want to make sure, if you feel the chest muscles, these chest muscles are different from one side to the other. The right side is more predominant than the left side. And so there's a difference. Even though he's standing pretty square on his front feet, he's definitely got some issues on his chest. So what I'm going to do is we're going to do some adjustment on him. And what I want to do is get him standing. Yeah. Can we stop just a minute and let everybody feel these spots? Okay, good.
That's even better.
Yes.
We need to stop.
I want you to come up here and feel this, okay, before we go too far. First of all, I want you to, each one of you to feel up here on his neck. Everybody come up here. All of you come up here, because I want you to feel this. Feel the difference right here on the width from one side to the other.